Hello viewers, welcome back to the Digestive News. Today we currently at Pajara, where we attending MRC's program. MRC today is celebrating 75 years impactful research. Today we join the world and also the MRC Unit School of Hygiene in London to celebrate its 75 years of success in research. For more of the news, follow us in Digestive News.
I would like to welcome you to this open day of the MRC Unit de Gambia, the London School of Hygiene and Tropical Medicine. I'm Professor Umberto D'Alessandro. I'm the director of the MRC Unit. We organize this open day to celebrate the 75 years of work of the MRC Unit de Gambia at the London School of Hygiene and Tropical Medicine. And during these 75 years, the unit has conducted research, produced results that had a profound impact on the healthcare provided in the Gambia, in African countries and across the world. One of the examples, and I like to use, is the insecticide to the bed nets, which with a study I did in 1990, 1994, that showed that bed nets reduce deaths in children by about a quarter. And now this intervention is implemented in every country across the world with malaria. The other example are vaccines. Many vaccines that now given to Gambian children and also other children across the world have been studied here at the MRC Unit de Gambia. These results could not have been possible without a very close collaboration with the Gambian government and more specifically with the Ministry of Health. Ministry of Health is our most important partner and we are still working closely together. I also like to take this opportunity to thank all the communities that have participated into our studies, the community leaders and all other stakeholders that have made our research successful. We train doctors, we train scientists, and a large proportion of these scientists and doctors are also Gambian. The other thing that we are doing is to provide health care. We have a clinical service department with 42 beds and an outpatient service that see about 100,000 patients per year. So you can imagine that this is a major undertaking for the unit. So for the future, we hope that we will be able to continue to provide these services, and we hope that we will continue to do research that is meaningful and that will provide results that will help in increasing or improving the quality of the healthcare. So during this open day, you'll be able to see what we are doing, what our research is about, and we are going to see our lab, and hopefully you're going to enjoy it. Thank you.
Contact is going to be healed. So it goes into the lungs, so there's infection in it, starts spreading, bacteria starts spreading. That's a good question. Well, the genes are not the only thing that can be used, but for now we feel that because when you look at the genetic studies, you can find more information. And there's a lot of people who think this is the best way for us to do it. And we look at other methods of finding
the use of a new technology to administer a main vaccine. Now, measles and rubella are two infectious diseases that are common in the country. They are both viral infections. Measles affects young children and kills over 100,000 children each year in the world. Rubella is also an infection that is important because when pregnant women get it, they can lose their children or have children that are born with severe deformities. The good news is that both of them are preventable with the vaccine. Currently it's an injectable vaccine. But to prevent it from spreading in the community, you need to have at least 95% of children population vaccinated with it. Currently, the Gambia has about 85%, so there's a long way to go. And we are hoping that our new technology will help us increase the coverage. So it's a patch that has small needles, we call micro needles, which are too small to see with the naked eye, and they have the vaccine in the needle. When it is applied to the skin, it dissolves and gives the vaccine into the skin, which then goes to the whole body. The advantages of this are it is less painful, so as you can see, when it was given to the children, they didn't seem to mind so much. It's also stable at room temperature, so you do not need to store it in the fridge. The current vaccine being used needs to be kept in the fridge, which is difficult for any reason. It's also easier to give, you don't need as much training to apply the patch.
So we are disinterested in the samples we have collected after the different variants break out. That was the Alpha variant, the Delta, and the Omicron. Although we know that the Omicron has been known to be very, very infectious and was actually predicted to have been very, very deadly, but that was not the case. What could explain this? Although we seem to have a very high infection rate, but the severity was low. So we believe that the immune system definitely played a huge role. Probably people that were exposed to the different variants prior to the Omicron variant are able to recognize this virus.
Looking at this, you can see that statistically there's no difference. So there's no difference here. But mothers who are given the tetanus toxoid in the Gambia, mothers are given tetanus toxoid vaccine when they're pregnant. We are also trying to follow up this case of the mothers who are given the TT, which is the tetanus toxoid, to see if they will have a longer protection. And looking at this, we can see that there is the protection is longer, and then because it's statistically significant, right? So here,
microorganisms that are found on human beings, antibiotics can actually affect you. We have important bacteria in our bodies and in our bodies that we need for our survival, right? So we want to know whether this azithromycin will have a long-term effect on the kids, right? So basically, this is what the study is actually looking at. And
Mrs. Mrs. Adam Drame. This is Mrs. Adam Drame, also a staff and a member of Medical Research Council Unit of the Gambia. Mrs. Adam, you're welcome.
Thank you, and good morning. MRC is celebrating 75 years of existence in the Gambia. So we're celebrating 75 years of existence and the impactful research that we have done in 75 years.
Okay, one thing, can you just tell us some of the achievements that the MRC unit has achieved for the past 75 years within the local people, that's the community members, and also to the national level that you talk about the government stakeholders, where you have the students, because we have seen a lot of students here, a lot of community members, like we know MRC have always been engaging the young ones and most especially the community leaders too. What are some of the things that you can tell us that you have done within the past 75 years? And today you are here celebrating the 75 years of impactful health research for the MRC.
Okay, so as you would know, I was on here 75 years ago. But yes, we are part of it today and celebrating it today. The work has started back then, and then we are here now and then celebrating it. So some of the achievement that MRC has done over the years is numerous. It's countless, and it has been very impactful. As you know, MRC operates a clinical services department which sees patients over hundreds of thousands a year. So that was just mentioned in the unit director's speech. Again, MRC trains its staff. So we have staff that have come to the unit from um, grade 12, O levels, and MRC has trained them, and they're now PhD holders. Some of them are now postdocs. So these are just few of the many that MRC has done for its staff and for the community. For the community, we involve more with the community because of the research that we do, and the relationship has been cordial with the government, with the communities. So we're very thankful to the Gambian government. We're very thankful to the local communities. We're very thankful to the staff as well because they're the ones that have made it happen all these years. Those of us that are here and those that were not here, those that have been here more and are normal. Yes.
What are some of the things that we the society are waiting, or we the society are expecting from the MRC unit in the Gambia in the next 15 years or in the next 5 years from MRC?
So I'll say more of everything better. Just to answer that question, let's say more of everything better because as you know, science it evolves every time. Um, Innovations come every time. So and then this is research. So we'll say let's just be hopeful that it will be best and better. Yes.
Maybe then before we just allow you to go because we know you are very busy today. But you can tell us something about MRC and then how one can be a member of MRC.
So we have a website where the vacancies are posted. That is the www.mrc.gm. There we have the all vacancies as they come in. They're posted there, and if it fits your requirement, you can apply. We have a very transparent, free and fair recruitment process. Also, school leavers and university graduates do benefit from our internship program. So to apply for the internship program, you send an email to internship@mrc.gm and request for the internship form. The form will be sent to you. You complete, send it back together with your academic documents, and now we take it up from there. When an internship opening is available, and you are selected, we contact you and you come. So many thousands of Gambians, thousands of youths have benefited from our internship program.
Thank you very much, Miss Adam. Thank you very much.
Thank you too.
Still celebrating with MRC the 75 years of impactful health research. The director of MRC, Dr. Alejandro, also mentioned some of the achievements they have in past 75 years. He also said he would like to thank the Gambia government for making it possible for them to reach at this level. He also elaborated that he will thank various stakeholders that have been working with them tirelessly to achieve these goals. He would like to thank the members of the community, especially the community leaders and also the school children who make it possible for them to be at this level today. The program officer also, Mrs. Adam Sanya, also elaborated most of the achievements they have achieved within the past 75 years. This is the Tigers TV News. I am Binta Sengo.
Fight Against Cyberbullying presents the two Gambia's finest artists, Jaliba Biate and Jalinene Suso, live at Semega Jane Hall on the 38th of December 2022. Mandin Kolko, Nunkun Kuntuta Nyadi Muka Mfale, Andun Konkoto Murkotole Konkoto Kuto Koto Kulkoto Bonya, Nilsuto Dunya Karafa Joman, Mrs. Kadi Lailo, Mr. Demba El Jame and Zainab Musaja, Mrs. Fatu Abbas Jai, Sisters of the Night, Mrs. Aja Boja, Mrs. Fantaba, Queens of the Night, Mrs. Balima Suma, Mrs. Fatunjai, Chief Guest of Honor, Honorable Yankuba Songo, Honorable Siaka Songo, Honorable Abubakar Jawar, Honorable Ibrahim Singh, Honorable Dusa, Fathers of the Night, Honorable Alaji Konte, Honorable Sekumba, Mothers of the Night, Mrs. Fatu Baronjai, Mrs. Fatu Kama, Brothers of the Night, Mr. Ansu Singade, Mr. Pajan, Chief Patrons, Mrs. Yai Kamara, Mrs. Asa Koita, Mrs. Hadinjai, Mrs. Binta Jaba. Proudly sponsored by Jaina Beauty for all your natural beauty products, Budget Designs and Zozo Teranga Beach. Cyberbullying, wala mnyintu ko nyolo me ala katar nyin social media. Pruka kumfanyin banko kan wala bemba sotulale. December karuli kansabo. Tickets VIP $1,500, normal $300 is all.